If you are over 60 years old, listen very carefully, because what I'm about to share with you may be one of the most powerful exercises you will ever do. And it requires no gym, no equipment, no long walks. In fact, many surgeons and physical therapists agree this one simple chair exercise can be more effective than walking for preserving strength, balance, and independence as you age. And the best part, you can do it right now. Many people over the age of 60 believe that as long as they walk every day, they are doing everything they need to stay healthy. And I want to be very clear with you right now, walking is beneficial. It improves circulation, supports heart health, helps control blood sugar, and keeps the joints moving. Walking is natural, it's comfortable, and is something most people can do well into older age. But here's the part that most people don't understand, and this is critical if you want to stay strong and independent as the years go by. Walking alone is not enough. As we age, our bodies undergo a very specific and predictable change. Beginning as early as our 30s, we start to lose muscle mass. By the time we reach our 60s and beyond, that muscle loss accelerates unless we actively do something to stop it. This condition is called sarcopenia, and it is one of the main reasons older adults struggle with weakness, poor balance, difficulty standing up, and an increased risk of falls. This is not about appearance, this is about function. This is about whether you can get out of a chair, climb stairs, or catch yourself if you trip. Walking does not place enough demand on your muscles to stop this process. When you walk, your body quickly adapts to that movement. Your muscles perform the same low-level contraction over and over again. There is very little resistance, very little challenge, and very little signal to the body to preserve or build muscle. In simple terms, your muscles are not being asked to get stronger. They are only being asked to move, and movement alone does not prevent muscle loss. This is why you can see someone who walks every single day yet still struggles to stand up from a chair or feels unsteady on their feet. The body works on a principle called use it or lose it. If your muscles are not challenged, your brain assumes they are no longer needed. As a result, muscle fibers shrink, strength decreases, and reaction time slows. This is not a failure of willpower. It is a biological response. And walking, while excellent for endurance, does not provide the strength signal your muscles need after 60. Another important point many people overlook is this. Walking primarily works your muscles in a very limited range and in a forward direction. Life does not work that way. Real life requires you to push, rise, stabilize, and control your body weight. Getting up from a chair, stepping onto a curb, carrying groceries, or regaining balance after a stumble all require strength, not just motion. If walking were enough, we would not see so many active walkers who still experience falls. This is why surgeons, physical therapists, and rehabilitation specialists emphasize strength-based movements for older adults. After surgery, after injury, after joint replacement, one of the first things patients are trained to do is not walking, it's standing up and sitting down properly. Why? Because that movement restores functional strength. It teaches the body how to support itself again. Walking does not train you to stand up. Walking does not train you to stabilize your hips. Walking does not train you to control your descent when sitting down. And these are the exact movements that determine whether you remain independent or become dependent on others. Now I want you to understand something very important. I am not telling you to stop walking. Walking is still valuable, but it must be seen for what it is. Cardiovascular exercise, not strength training. After 60, your priority must shift. You are no longer training just for endurance. You are training for function. You are training to keep your body capable of supporting itself. Muscle is your protective armor as you age. It cushions your joints, stabilizes your bones, improves insulin sensitivity, and even protects your brain. When muscle mass declines, everything else follows. Balance worsens, metabolism slows, and confidence decreases. People stop trusting their bodies. And once fear sets in, movement decreases even more. That is a dangerous cycle. Walking alone does not break that cycle. What breaks it is giving your muscles a reason to stay strong. Your body must feel resistance. It must feel effort. It must feel control. And that doesn't require heavy weights or intense workouts. It requires purposeful movements that challenge your muscles to support your body weight. This is why simple strength-based exercises outperform walking when it comes to preventing falls, maintaining independence, and preserving quality of life after 60. I have seen countless people who believed they were doing everything right because they walked every day, yet they still felt weaker year after year. The moment they introduced basic strength movements into their routine, everything changed. They stood taller, they felt steadier, they regained confidence in their bodies. That is not coincidence. That is physiology. Walking keeps you moving. Strength keeps you living independently. So if you are over 60 and walking is the only form of exercise you are doing, I want you to understand this with clarity and without fear. You are not doing anything wrong, but you are not doing enough. And the good news is it doesn't take much more. Just a few minutes a day of the right kind of movement can make a dramatic difference. Your body is still capable of adapting, your muscles are still listening, but you must speak their language, and that language is strength. Because after 60, the goal is not just to move forward, the goal is to be able to rise, to stabilize, and to stand strong today, tomorrow, and for the rest of your life. One of the biggest mistakes people make when they think about exercise is believing that it has to be complicated to be effective. They imagine machines, weights, long routines, or movements that feel intimidating. But the human body doesn't work that way, especially as we get older. What the body truly responds to are functional movements, simple actions that mirror what you do in daily life. And that's exactly why the chair sit-to-stand exercise is so powerful. When you sit down and stand back up, you are engaging some of the most important muscles in your entire body. Your thighs, known as the quadriceps, are responsible for straightening the knee and lifting you upward. Your glute muscles in the hips generate power and stability, helping your pelvis stay aligned and your spine supported. Your hamstrings assist in controlling the movement, especially as you lower yourself back down. At the same time, your core muscles activate to keep you upright, balanced, and protected. This is not an isolated exercise. This is a full body coordination pattern. Every time you rise from a chair, your nervous system sends signals to multiple muscle groups simultaneously. That coordination is what keeps you steady, confident, and capable. And this is exactly what begins to fade as we age if we don't actively train it. The chair sit to stand brings that communication back online. What makes this movement so unique is that it works your muscles through a complete and meaningful range of motion. Your hips bend and extend, your knees bend and straighten, your ankles stabilize, your spine stays tall. This combination is essential for real-world strength. Many exercises work muscles in isolation, but life doesn't isolate muscles. Life demands cooperation. That cooperation is what prevents falls. When someone trips, they don't fall because their heart isn't strong. They fall because their legs can't react quickly enough or support their body weight. Strong quadriceps and glutes allow you to catch yourself. A stable core keeps you upright. Practicing the sit-to-stand movement reinforces this pattern over and over again, teaching your body how to respond under pressure. Another overlooked benefit of this exercise is what it does for posture. As you stand up correctly from a chair, your chest naturally lifts, your shoulders align, and your head stays centered over your spine. Poor posture is not just an aesthetic issue. It affects breathing, balance, and even digestion. When posture improves, the entire body functions better, and posture begins with strong hips and legs. Many people assume that leg exercises will harm their knees, especially if they already experience discomfort. But in reality, the opposite is often true when the movement is done correctly. The chair sit to stand strengthens the muscles that support the knee joint. Strong muscles reduce stress on the joint itself. Instead of the knee bearing all the load, the surrounding muscles absorb and distribute force properly. This is why physical therapists rely on this movement during rehabilitation. It restores confidence in the legs without excessive strain. Balance is another critical component. When you stand up from a seated position, your body must shift its center of gravity. That requires control, awareness, and coordination. Practicing this daily improves proprioception. the body's ability to sense where it is in space. Better proprioception means better balance. Better balance means fewer falls. And falls are not minor events as we age. A single fall can change everything. Loss of independence, long recovery times, and fear of movement often follow. Preventing falls starts with strengthening the muscles that keep you upright. The chair sit to stand does exactly that. This movement also improves circulation as the large muscles of the legs contract and relax. They act like pumps, helping blood return to the heart. Improved circulation means better oxygen delivery to tissues, less stiffness, and faster recovery. This is especially important for individuals who sit for long periods during the day. There is also a neurological benefit that cannot be ignored. Strengthening movements stimulate the brain. They improve reaction time, coordination, and mental clarity. Your brain stays sharper when it is regularly challenged to control the body. This is one of the reasons strength training has been linked to improved cognitive health in older adults. The beauty of the chair sit to stand is that it meets you where you are. If you are weaker, it challenges you. If you are stronger, it continues to challenge you. You can slow it down, add pauses, or increase repetitions. The movement grows with you. And perhaps most importantly, it builds confidence. When people regain strength in their legs, they stop fearing everyday movements. They trust their bodies again. They move more freely. That confidence leads to more activity, and more activity leads to better health overall. It's a positive cycle. This is why this simple exercise is so effective. It doesn't just strengthen muscles. It restores function. It reconnects the body. It prepares you for real life. Strong legs are not optional as you age. They are essential. And the chair sit to stand is one of the most direct, safe, and powerful ways to keep them strong. Because when your legs are strong, your foundation is strong. And when your foundation is strong, you stand taller, move better, and live with greater independence at any age. One of the greatest fears people have as they get older is getting injured while trying to exercise. They've been told to move more, but at the same time they're warned about protecting their knees, their back, and their joints. This creates confusion, hesitation, and often complete avoidance of movement altogether. And I understand that fear because once you've had pain, surgery, or instability, the last thing you want to do is make things worse. This is exactly why safety matters more than intensity after the age of 60. When surgeons and physical therapists evaluate exercises for older adults, they are not looking for what burns the most calories or builds the most muscle in the shortest time. They are looking for movements that are controlled, predictable, and repeatable. Movements that strengthen without shocking the joints. Movements that build confidence rather than fear. And that is why the chair sit to stand is so highly respected in medical and rehabilitation settings. This exercise keeps your body in a stable, supported environment. The chair acts as a reference point. It gives your brain a sense of security. You know exactly where you're going to sit, and you know exactly how high you need to stand. That predictability reduces anxiety and allows the nervous system to relax. When the nervous system feels safe, muscles function better. Another key reason this movement is surgeon approved is because it respects joint alignment. When done correctly, your knees track naturally over your feet. Your hips hinge properly, your spine stays upright. There is no twisting, no sudden impact, and no excessive load. The body moves the way it was designed to move. Compare that to many common exercises that place unnecessary stress on the joints, deep lunges, fat squats, jumping, or unstable surfaces. Those movements may be appropriate for younger individuals, but they often carry more risk than reward for older adults. The chair sit to stand removes that risk while keeping the benefit. After surgeries such as knee replacements, hip replacements, or spinal procedures, one of the first functional movements patients are reintroduced to is standing up from a chair. There's a reason for this. If you can't safely stand up and sit down, nothing else matters. Walking, stretching, or even balance exercises become secondary. The chair sit to stand restores the most basic and essential function first. Surgeons trust this movement because it allows gradual progression. You can control the speed, you can control the depth, you can use your hands if needed. You can adjust the height of the chair Every variable can be modified to match your current ability. That level of customization makes it appropriate for a wide range of conditions, from arthritis to osteoporosis. Another important aspect of safety is the way this exercise distributes force. Instead of placing pressure on one joint, the load is shared across the hips, knees, and ankles. Large muscle groups do most of the work, which protects smaller structures like ligaments and cartilage. This balanced load reduces wear and tear and promotes long-term joint health. Pain is often a signal of weakness rather than damage. When muscles around a joint are weak, the joint takes on more stress than it should. Strengthening those muscles through a safe movement like the sit to stand often reduces pain rather than causing it. Many people are surprised to find that their knees feel better after consistently practicing this exercise. Balance support is another reason medical professionals recommend it. The chair provides immediate support. If you lose balance, you are never fully unsupported. This dramatically reduces the risk of falling during the exercise itself. And as your strength and balance improve, you naturally rely less on the chair. Progress happens organically. The controlled nature of this movement also makes it ideal for individuals with back concerns. There is no spinal flexion under load, no twisting, and no sudden movements. When the core engages naturally during the stand, it supports the spine in a neutral position. This is far safer than exercises that involve bending forward or lifting weight away from the body. Consistency is the foundation of progress, especially after 60. An exercise that feels risky or intimidating will never be done consistently. But an exercise that feels safe and familiar becomes part of daily life. That is where real change happens. The chair sit to stand is easy to repeat, easy to remember, and easy to integrate into routine activities. Medical professionals also value this exercise because it translates directly into daily function. There is no disconnect between the exercise and real life. Every repetition reinforces a movement you already perform multiple times a day. This reduces the learning curve and increases carryover into daily activities. Perhaps the most powerful reason this exercise is surgeon approved is that it preserves independence. Independence is not about lifting heavy weights or running long distances. It is about being able to rise from a chair without help. It is about getting out of bed. It is about using the toilet safely. These are the movements that determine quality of life. When an exercise strengthens those abilities without adding risk, it becomes invaluable. This is not about pushing your limits. This is about protecting your future. Safe, controlled, and purposeful movement is the key to aging well. And that is exactly what the chair sit to stand provides. One of the most powerful truths about the human body is that it does not require hours of exercise to change. Especially after the age of 60, it is not the quantity of movement that matters most. It is the quality and the consistency. Many people believe that if they cannot commit to long workouts, then it is not worth doing anything at all. That belief is one of the biggest obstacles to staying strong and independent as we age. In reality, just a few minutes a day of the right movement can completely transform how your body feels and functions. When you perform a simple exercise like the chair sit to stand, you are sending a clear message to your muscles, your bones, and your nervous system. Stay strong, stay capable. That message does not need to be repeated for an hour to be effective. It needs to be repeated consistently. 5 to 20 controlled repetitions can be enough to stimulate strength, improve circulation, and reinforce balance. Muscles respond to regular signals, not occasional effort. A short daily routine keeps those signals alive. As we age, recovery takes longer. Long, exhausting workouts often lead to soreness, fatigue, or discouragement. That's why many people start strong and then stop. A brief routine done once or twice a day fits naturally into daily life. It doesn't overwhelm the body or the mind. It becomes sustainable, and sustainability is where real results come from. This approach also reduces fear. When people know an exercise will only take 2 minutes and won't leave them exhausted or in pain, they are far more likely to do it. That consistency builds momentum. Momentum builds confidence. Confidence leads to more movement. And that cycle strengthens the body in ways that sporadic, intense workouts never can. Independence is built on small abilities performed repeatedly. Standing up from a chair, sitting down with control, maintaining balance. These are not dramatic achievements, but they are life-defining ones. Practicing them daily keeps those abilities sharp. It keeps the body prepared for real-life demands. Another important benefit of short daily exercise is improved circulation. When you activate the large muscles of the legs, even briefly, blood flow increases throughout the body. Oxygen and nutrients reach tissues more efficiently, stiffness decreases, energy improves. Many people notice they feel more awake, more stable, and more confident after just a few repetitions. This simple routine also has a profound effect on balance. Balance is not something you either have or don't have. It is a skill. Skills improve with practice. Every time you stand up and sit down with control, you are practicing balance. Over time, your body becomes quicker to respond, steadier under pressure, and more aware of its position in space. Strength gained from brief daily practice accumulates. Muscles don't disappear overnight, and they don't build overnight either. But consistent effort, even in small amounts, compounds. After a few weeks, movements feel easier. After a few months, confidence returns. After a year, independence is preserved. One of the most overlooked benefits of short daily movement is its effect on the mind. Exercise improves mood, reduces anxiety, and increases mental clarity. Knowing that you have done something positive for your body, even something small, creates a sense of control and optimism. That mindset is incredibly important as we age. People often underestimate what their bodies can adapt to. They assume that because they are older, change is no longer possible. But the human body remains responsive throughout life. It may adapt more slowly, but it still adapts. A 2-minute routine is enough to trigger that adaptation. There is also a protective effect on the joints. Gentle, regular movement lubricates joints, strengthens surrounding muscles, and reduces stiffness. This helps maintain mobility and reduces the likelihood of injury. Long periods of inactivity do far more damage than short periods of controlled exercise. Time is not the barrier people think it is. Everyone can find 2 minutes. The challenge is not time, it is priority. When you understand that these 2 minutes protect your future independence, they become non-negotiable. Many people wait until they feel weaker or unsteady before they take action, but prevention is far easier than recovery. A small daily habit practiced now can prevent major problems later. That is the true power of this approach. This is not about pushing through pain or exhaustion. It is about gentle, consistent effort. It is about respecting your body while still challenging it enough to maintain strength. That balance is essential. If you do 5 repetitions today, that is a victory. If tomorrow you do 6, that is progress. There is no finish line. The goal is not perfection. The goal is continuity. Because independence is not lost all at once. It fades slowly when movement stops, and it is preserved slowly when movement continues. 2 minutes a day may not seem like much, but when those minutes are invested in the right movement, they can give you years of strength, confidence, and freedom.